Imagine someone gives you a sugar pill, but tells you it's a new drug known to cause mild headaches. Hours later, your temples begin to throb. The pill contained nothing, yet the pain is real, measurable. This isn't just in your head, it's a demonstration of the nocebo effect, the lesser-known malevolent twin of the placebo. Instead of belief making you better, negative expectation manufactures real physiological symptoms. Your brain, anticipating a negative outcome, instructs your body to create it. This isn't just about headaches. Studies have shown that telling subjects a harmless cream will cause an itch can induce dermatitis. The expectation of pain releases anti-opioid and pro-inflammatory agents like cholecystokinin in your brain, effectively priming your nervous system to feel more pain. Before any physical stimulus is even applied, your body is already building the scaffolding for a negative experience. It's a self-fulfilling prophecy written in biochemistry, a phantom taking physical form purely from suggestion. Now, place this phenomenon in a clinic. A nurse approaches with a syringe. Their words become potent variables in this equation. The phrase, "This is going to be a big sting," is not merely a warning, it's an instruction. Your auditory cortex processes the words, but your limbic system interprets the threat. The sentence itself becomes a nocebo agent, preparing the brain for a significant pain event long before the needle ever touches your skin. Researcher Luana Kaloka at the University of Maryland demonstrated this with startling precision. In experiments involving painful injections, simply changing the verbal framing altered the subjective pain experience by up to 40%. Describing the sensation with low-intensity words like minor or brief versus high-intensity words like bad or sharp produced vastly different readouts on pain scales. Functional magnetic resonance imaging confirmed this wasn't just perception. The pain processing regions of the brain, like the somatosensory cortex, showed less activity. The words physically turned down the volume on pain. But why are these words so powerful coming from a nurse? It's because of cognitive heuristics, specifically the authority bias. In a complex and potentially threatening environment like a hospital, our brains seek shortcuts to determine what's safe. A uniform, a title, a clinical setting, these are all cues that signal expert. Your brain effectively outsources its sense of vigilance to this person, treating their words not as opinion, but as data describing an imminent reality. Beyond the words themselves lies a deeper layer of communication, prosody. This is the rhythm, pitch, and intonation of speech, the music behind the lyrics. A hurried, flat, or detached tone of voice is processed by the superior temporal gyrus and relayed to the amygdala, your brain's threat detection center. Even if the words are reassuring, a clinical, impersonal tone can signal a lack of care, which the brain interprets as a potential social threat, heightening overall alertness and, with it, sensitivity to pain. Conversely, a warm, empathetic tone does the opposite. It acts as an analgesic. When a patient perceives genuine empathy, their brain activates regions associated with reward and social safety, like the ventromedial prefrontal cortex. This activation can trigger the release of endogenous opioids, your body's self-produced painkillers. The nurse's empathetic tone doesn't just make you feel better emotionally, it can literally initiate a chemical process that blocks pain signals at the synaptic level. This creates a stark dichotomy. Clinical detachment, often trained into healthcare professionals to help them cope with difficult situations, can be counterproductive for the patient's physical experience. The patient's brain doesn't understand the coping mechanism. It only perceives the lack of social connection. A study in the journal Pain found that clinicians who displayed less engagement and empathy were associated with patients who reported higher pain levels, even when the procedure was identical. The detachment itself becomes a pain amplifier. Part of the mechanism behind empathy's power may lie in our mirror neuron system. These neurons fire both when we perform an action and when we see someone else perform that same action. They are fundamental to understanding others' intentions and emotions. When a clinician shows empathy, our mirror neurons may interpret that as a signal of safety and shared experience. This sense of not being alone in the experience reduces the cognitive and emotional load of the pain, freeing up resources and dampening the overall negative sensation. The impact of these brief interactions extends far beyond the clinic room. A single negative experience, amplified by a detached tone or a poorly chosen word, can create a lasting fear of medical procedures. This can lead to healthcare avoidance, where people delay necessary checkups or treatments, allowing minor issues to become major problems. The memory of the amplified pain becomes a barrier to future health. The sound of a voice can, over time, have consequences as significant as the procedure itself, shaping a person's entire relationship with medicine. Monotony has grown fast. Nearly 2,700 people have watched in the last few weeks, yet less than 0.03% are subscribed. It would mean a lot if you joined by hitting subscribe. And again, thanks for watching.